Hello and welcome to HSM 430. For today's class, we are going to be discussing conceptual frameworks for interprofessional teamwork. There are three learning objectives for today's class. We're going to describe what the contingency approach is and how it helps us to understand interprofessional work and illustrate different forms of contingency approach to interprofessional work, and we'll be doing that using case studies. And then finally, describe the four domains of this conceptual framework. So, starting with the contingency approach. The reason why there's been a call for a contingency approach is because how healthcare is being delivered has increasingly become complex in the way that healthcare is organized, coordinated, and delivered. There are more and more professionals of varying specialties that are now being required to work together closely to share information and to reach agreements in their work. Thereby, there's a need to have a way of understanding how this complexity with the many different healthcare professionals, how that works in terms of a teamwork. So, interprofessional teamwork, the way that is meant to be, or the very, very ideal situation of it, is that there should be very high levels of interdependence, of integration, and of shared responsibilities. And this means that they have a couple of these core elements. You have a shared identity, you have clarity for each person's work, and each person having clarity about what work the other members of the team is doing. And there is very high interdependence in the sense that because they're all working together, they're all having to meet regularly and have conversations regularly before making decisions. So one person is not going off and doing his or her own thing. There is a lot of interdependence on it. And then there is integration. All their works are all integrated and trying to reach a joint goal that they are all working towards as a team. And then there's shared responsibilities, and then team tasks are being, even though they are unpredictable and they are urgent, there is a way that the team has come up a way such that even if things suddenly happen and they have to do things differently from predicted, it doesn't have the team all falling apart because they have made plans for this unpredictability and for urgency and for complexity coming into their work. So these core elements are all very desirable, but it may not be possible to achieve that in every team with every patient, hence the need for this contingency approach. So now we're going to get into how this the different forms of this interprofessional work in terms of their contingency approach. So there are different forms of interprofessional work, and they have varying levels of interdependence and integration, starting with teamwork being the one that has the highest level of interdependence and integration, and ending with networking that has the lowest levels of interdependence and integration. So this is an example of a adaptive teamwork in this case study. This is an acute care setting, and is a geriatric 4 team, and it has numerous specialists that are working on it. You have a dietitian, you have nursing, occupational therapist and stuff, and they are all working together to care for older adults who suffer injury due to fall. So what makes this a teamwork is because the team approach is they're regularly communicating in order to adapt the needs of their patients to how they are doing work, and they're shifting seamlessly from providing health care, which involves physicians and nurses, to rehabilitation care, where you have the dietitians and physiotherapists, to resettlement care, where you have occupational therapists and social work. So this is why it is teamwork, because they are all working together even as they are moving from different stages of the patient care, they are all working closely together. Now, the reason why it is adaptive is because as the patients are moving along the care continuum, there's less work there's less integration and interdependence that is being done. At the very initial admission, there's a lot of work that needs to be done, so there's a lot of intensive input from all the teams and all members of the team, and then it gradually moves to collaboration and coordination by the time the patients have been they have finished rehabilitation and have now returned home. So that's what makes it adaptive, because they are picking the kind of team work they're going to do based off on the need of their patient. So this is an example of collaboration. In this case study, you have a large general medical ward that has physicians, nurses, physiotherapists and stuff. So what makes this a collaborative teamwork is because in general the ward members are working well together, they are communicating, the meets briefly, but this is as need be, and they go over patients' issues. But after this ward-based interaction, they all go their separate ways, and they are doing the things that they are meant to do. There's no shared team identity. They're just people who work in the same setting and kind of walk around the same area. So there is it's not as if you could say this is a team that works on geriatric 4 like it happens in this case. In this, they are all meeting different care, and they're all basically separately working on different stuff. And also because they're not meeting very often, and they're meeting a whole lot less often than the teamwork, so because of how the fewer times they are meeting, there's a lot less interaction that they are having, and therefore there's a lot less interdependence that is going on with that. So with coordination, they are meeting even less than collaboration. So you see in this case studies, the professionals are meeting once a week, and once they meet once a week, they are just briefly reviewing and discussing their shared work. They may not necessarily be talking about particular patients. They may have met like 10 or 20 patients in that week, and they would use maybe 1 or 2 examples to discuss what their week went, how their week went by. So it's a lot less interdependent and a lot less integrated than called collaboration, and also far less integrated and interdependent than teamwork. And then finally, we have networking. So in this case study, what we have is a group of nurses, nutritionists, and physicians who have a mutual interest in food safety. And they are meeting once a month to discuss and debate the subject. They may not even be discussing the cases that they are meeting. They're just basically sharing ideas, and do regularly email each other just to keep up abreast of what everybody else is doing, and just to keep the relationship kind of close, so that you're not a stranger to the other person. So you can see that the dynamics of this team is very, very, very different from how it is with the adaptive team. So this is to give you a sense of how these different teams all are very different, and depending on the goal of the team, you could decide maybe this is best to work as a adaptive team, or this may be best to do this as networking. So this is not to say that one is better or worse than the other. Everything has to depend on what the purpose of the team is and what they're trying to accomplish. Some teams that require adaptive teamwork but is working on networking is probably not going to achieve the same outcome that it was. But some teams or some outcomes do not require the level of interdependence and integration that adaptive teamwork requires. So it's basically having to look at it in context to know which is better depending on the the objective of the team. So there are a couple of researchers that are trying to differentiate one of the teams from the other. So you have Bruce that looked at it as looking at teamwork as, in sense of committed teams, and network being more of a nominal teams. And then Drinker and Clark kind of looked at teamwork as interactive, as interdisciplinary team, while networking they kind of described as being ad hoc task group. So you can see just from the description that there's a lot, there's a lot less interdependence and integration with networking versus that of teamwork. So what are the domains of interprofessional teamwork? So this is the domains of interprofessional teamwork, and we look at it's kind of a 4 points. There's relational. With relational, we could be looking at professional power, hierarchy, team roles. You have processional, that's looking at time and space, complexity. Then you have organizational, that is looking at professional representation, fear of litigation, and then contextual, that is looking at culture, diversity, and political will. So all of these different parts of interprofessional teamwork all interact with one another. They all influence the other. They don't work in silos. They are not all coexisting as one separate from the other. They are all playing a part in determining how a team looks and how it works. So that's why we need to look at it from that lens. So with the relational factors, professional power, so not everybody in a team has the same power professionally as everybody, as it has to do with healthcare by the design, the way it's, the origin of healthcare, especially how hospitals are being run. Doctors still kind of hold as still very much at the apex of professional power when it comes to healthcare, more than any other many other professional healthcare professionals. It used to be a time when it was the surgeons who were, the ones that everybody looked up to. It's a lot less there, but it's still the entire doctors who still kind of have the highest professional power. So what you could have happen is that when you have a doctor in the midst of a team, the doctor as as a byproduct of their professional power may appoint themselves the leader of the team, and regardless of whether they know how to lead a team or not. So that becomes where that influences that. And then you have hierarchy. I'm also going to use the example of the doctor member of the team as an example. In a situation whereby you have a medical doctor that's decided that they are most suited to be the leader of the team and not doing a very great job of it because of the hierarchical nature of doctors and the rest of the other professionals. Someone who is not a doctor may feel a lot less inclined to say, no, you're not doing such a great job, I think somebody else is going to do a job, just because they are a little bit lower on the hierarchy than a medical doctor is. So that affects teamwork and can have an inhibiting effect on teamwork. So socialization also has a lot to do with that. The way that interprofessional teamwork is going to work in let's use for example a setting whereby there's a lot of focus on everybody putting in input, is going to be very different from a setting whereby doctors are seen as being the last voice of reason or the people that make the final decision. So even though you may not have a doctor, for an example, appointing themselves as the leader of the team, you may have members of the team deciding, oh, we have a doctor in our midst, you are the leader, you speak for us. So this is where socialization does come in. Then team composition is another thing, and there's evidence to show that when teams are larger, larger teams are a little bit more difficult to work seamlessly together than smaller teams. Some of the evidence does show that anything more than 10 members in the team, then it becomes a little bit difficult to coordinate everybody. And this is because everybody you want everybody to have a say in things, and the larger the team, the more consideration you have to pay to everybody's viewpoint. And sometimes the larger the team, you may have some members of the team that basically just hide away somewhere, and they don't get to be a part of the team. They're not really participating in it as a result. Please look at box 1.1 of the textbook, where it talks a little bit more in detail about interprofessional teamwork and hierarchy, so that you can get a better sense of what we mean by that. So for processional factors, we have time and space, and a lot of it is because interprofessional teamwork requires quite a lot of time, that it has that in terms of meeting and discussing and coming to an agreement. It does limit the availability that healthcare professionals will have when it comes to that, especially because if a member of a team is not on a salary, the person is being paid for work, the time that they spend going for meetings may not be accounted for when it comes to the hours that they have worked. So that becomes a challenge for them. So you may have people in the team that would have been more involved in it, but because that is essentially going to be unpaid work, they may not be so inclined to be part of a team. So that does influence teamwork. And then you have routines and rituals. There are some actions or some behaviors or procedures that are standardized and need to be followed regularly across different healthcare settings. In situations like that, it can be a bit more clean cut, and everybody knows how they're meant to behave. In some settings, in some instances, there are no standardized actions or procedures, and then that could define how that team functions in terms of meeting these situations. And then you have information technology. While information technology has done a lot especially in reducing the time and space that is that interprofessional teamwork consumes, it also doesn't eliminate everything, because you still have the problem of internet, whether there's a good network where people are joining the meetings from. If the network is bad for one of the members, they will not be able to participate, and it may cause some distraction for the people who are not experiencing any challenge with their network. So that could also bring in some challenges to that. And of course, you have the unpredictability of healthcare setting. Some of it could be on the macro level. Let's just, for example, funding is pulled out for some programs, some hospital programs or community programs, and then suddenly whatever that program meant to achieve or hope to achieve is no longer going to be achieved, and everything gets shelved, and then so will the team. The team gets shelved, and everybody has to go their different ways. Or it could be something as huge as COVID, the way COVID really threw a big spanner into the wheel of the healthcare setting. So that could also influence the way teams will work. So please look at box 4.2 to look at how routines and spatial issues do affect teamwork. For organizational factors, we have organizational support. Most healthcare, most social care teams are embedded within organizations, hence support coming from management is crucial. Now, a management team that decides that the time spent in meeting is not going to be counted as work hours, it just means that people within that setting are going to be very, very unlikely going to volunteer to be part of a team, no matter how passionately they feel about it, because they want to be paid for their time, and not everybody has the luxury of doing unpaid work. So that really does influence how a team functions. And then you have professional associations and unions. Generally, professions that are unionized are able to speak up for themselves, because associations, through policy documents, are able to collectively call for more interprofessional approach to delivering care, and therefore the things that they say will have more weight than other professions that are not as unionized and have a lot less say in the way things happen. And then finally, for organizational factors, we have fear of litigation. So this does have a lot of influence with interprofessional work, whereby everybody in the team is afraid of being the scapegoat if anything goes wrong, and you may find a lot less collaboration or openness in working as a team because everybody is trying to protect themselves. So what that then does is that it invokes secrecy among professions, and they're also maybe trying to undermine attempts to ensure patient safety if they feel it may have a knock-on effect on them, or them being litigated in the future. So that is something that influences how teams, interprofessional teams work. Please look at box 4.3 for how roles of organizational support does influence teamwork. So for contextual factors, we have culture. Now, if you are in a team where everybody is from the same place, speak the same languages, have the same social norms, some things are a lot easier to do because you may have a lot of non-verbal communication that is very easily understood by everybody. But where you have a team that you have a more diverse members, then you have to kind of break down your communication. You have to rely less on non-verbal communication. You want to do more verbal communication, but also you want to be there's a lot of emphasis on clarity. You have to make sure that what you say comes out very well in order not to cause misunderstanding or miscommunication. So and then if you're someone who goes to a completely different culture, you would understand, you may find yourself trying to understand the culture while trying to fit in with the team and being able to fully contribute to the team in the things that you're capable of. So that does bring its own challenges. However, having diversity in a team of people from different cultures does enrich the team when it comes to looking at problems, because now everybody doesn't have the same viewpoint about issues, so people are able to think beyond the box, and because they're coming from different perspectives, they were able to enrich the conversations and the broaden conversations, and people look at things from a much broader perspective than when everybody is all from that same place and understand the same place. So diversity does bring its challenges, but it does have a lot of pros to it, which is why these contextual factors does affect teamwork. So that's where you have the behaviors, the beliefs, the values that come from a diverse team, both having pros and cons to it. Diversity is a lot more important, particularly if there is diversity in the patients that you are seeing. When the patients group that you're seeing are very diverse, it's important if an interprofessional team is also diverse, so that they may be able to better understand the patient group. But if you have a very diverse patient group while the interprofessional team is not so diverse, there's bound to be miscommunication, because the way that things may be communicated would not be the way that it is received by the patients. And then gender does play a role in interprofessional teams. Unfortunately, in the medicine is being feminized. In the initial time when medicine became a profession, it was something that was mainly men did, because women were being limited from working. But as more and more women went into medicine, less and less men went into it. So you have this feminization of medicine now that has become, you still have the patriarchal nature of interprofessional work being influenced, where, for instance, if you have a male in the team, there may be some members of the team that feel that because there's a man in the team, that person should lead, or maybe they kind of have a voice more than the other members of the team. So these are all things that do come in and influence the way a team functions. And then you have political will, which is very connected to gender and connected to diversity. People from minority groups, or have a lot less political will than those from majority groups, so they are a lot less likely to have their opinions or their perspective being put in affected than those who are from the majority. And so that does influence a team and may cause imbalance within the team, the conversations that are happening in the team, and also conversations that happen on a larger scale. For an example, if you have a interprofessional team that they are mainly based on people with very little political will, no matter how great suggestions that they are making, the management may just decide, you guys don't matter enough for us to do this. Or if we did what you're asking for, is going to take away time and money from people who have the political will to get things done for us. So that does influence the dynamics of a team. So do look at box 4.4 to give insight on how contextual factors can affect teamwork. So this is where we end for today's class. Please remember to use the Q&A board to ask any questions if you require any clarity. Do have a lovely day. Bye.